Here we are. What the health? What the health, Jack? I'll tell you one dang thing.
No, I
Here
love
we
it.
are, you and me, sitting down, having a conversation, talking about chiropractic and
Yeah.
neurology. Sorry, I've been wanting to do that with the what the health intro for a long time, and I waited for you, Jack, to give you my best Hank Hill.
Well, it seems like you're always interested in the person sitting next or sitting up across from you, but now today you're not interested in me at all. So
Oh, get out of here.
we're just gonna wing it. We're just gonna have some fun.
We are going to
Talk about
have some fun,
things.
because as we started this, coming into this studio today, we had an aha moment about misconceptions.
Well, I'll clarify this for you. A lot of people, they think about chiropractic and they put it into one of two things, and it's either back pain or neck pain. And to be fair, there are a lot of chiropractors that do that, right?
Yeah. But pain in general, it's just
Yeah.
kind of lumped into a symptomatic pain, structural. Yeah.
Well, the psychology behind that's interesting. I'd want to know how that became the norm or became the thought about chiropractic. But I walked in and you were like talking to Eric, and you're like, maybe we need to change the name of chiropractic, specifically what you do.
Yeah.
I want to hear more about this just because there's so many misconceptions and so many people think about it's just back and neck pain, but it's so much deeper than that. And there's so many kids that find real healing inside of Vital Wellness Center aside from all of that.
So let's unpack a little bit of
Yeah.
this. So words are powerful. In the beginning, there was the word. And the word is vibration. And words are created by you spell words. And spells are spells. So when you cast a spell on something, you're using words to create something in another entity that you want to change.
There's power in the tongue,
There's power in the tongue. It's the rudder of the ship. And so our words are very powerful, and words have meaning. And the word chiropractic, when we break it down, chiro is kairos, Greek kairos.
Okay.
You have kairos time, and you have chronos time. Kairos time is God's time. Chronos time is man's time, chronological, chronos.
Okay, I got you now.
Kairos time is God's time. The Greeks had to wear kairos, which was a cross around their neck to signify their faith and their trust. So chiropractic, and its logo is an angel.
The chiropractic logo is an angel?
Is an angel.
I'm thinking about the chiropractic logo.
It's an angel. Words are powerful. Logos. Symbols are powerful. So words are powerful. Pharmacology, pharmakia is the Greek word, and that stands for witchcraft. All right? Witchcraft, which is the art form of the Luciferian religion. Witches are the doctors of satanic religion. I say doctors. It's the art form. It's what they do, witchcraft. And what they're doing is casting spells, right? So so spells are words that you use to cast whatever you want. So we can cast spells of prosperity, or we can cast spells of harm.
Yeah.
So this might seem like it's going everywhere.
No,
but
I'm on
believe
board.
me,
I'm on
it's
board with
coming
you.
back
Yeah.
around. Our words are powerful. Our tongues are the rudder. We must be very aware and aware of the words that we are using, because we're casting spells out there, and that which we think about and talk about we will bring about. So then that brings us back to the word chiropractic, right? So it's been kind of a flip that's gone on with the words that we use versus how we interpret them. We interpret as a kind of a whole with our culture. Pharmacology is powerful and, this higher level, right? And then when somebody says chiropractic, that energy drops down.
You're touching on something interesting here.
So it drops down because of how we've been programmed to believe what those words mean. But now let's be conscious. Let's let's dig in and let's like evaluate what these terms mean. And I just said pharmacology comes from the Greek word pharmakia, which means witchcraft. What's that logo of medicine and pharmacology? You know what that logo is?
No.
It's a serpent. It's the two serpents that go up the staff.
Yeah.
So we've got a serpent and we have an angel that are represented in the logos. Symbolism is powerful because that's also part of the spell.
Think about the spell that most of our world is under. Now, I'm not trying to get too crazy here, but you're hitting a good point. I want to let you keep going.
So with that, then, when we say pharmacology, that kind of has this vibration up here, they're smart, it's scientific, it's this, it saved the world, if we live longer with a blah, 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 blah. and we say chiropractic, and it goes, shoom. Well, I guess we go there if we got a little bit of back pain, we got a little bit of neck pain, shoot, go to chiropractor. It works good. You don't have to take no drugs and stuff. Sorry, I was about ready to get into my Hank Hill right there again. Well, I'll tell you one dang thing. I went to my chiropractor and he popped my back and I haven't felt so good since.
Predictive programming.
Great. So that's our programming.
Yep.
That's our programming. Now, really, if we unpack that, really, what is it? Chiropractic is about restoring life. God, the life that God put in us to heal and regenerate. And that's the vibration of life. That's our soul. That's our spirit. And chiropractic is about restoring that tone, neurological tone through the nervous system so we can express life to our full potential. Versus you go there when you're hurt and you're in pain. So if we can start shifting our ideas of what that is, and maybe we just change the name. That's kind of like what we were talking about at the beginning. Do we change the name? Do we call it Chiropractic? I don't know. I just kind of like the name myself. I like the name. I just think we need to shift our consciousness as to what it is and what it means. But it has been wired in to our culture. Like, you know how when a kid is born these days, it's like they're born to already use a cell phone?
Yeah.
Like they just know for some reason, and that's kind of an epigenetic thing, as like behaviors can get passed down, right? And that's why these kids are like, they're already like downloaded with that information. So societal norms kind of get downloaded epigenetically into our babies. And so, wow, we have to change our consciousness about what these entities are, chiropractic, pharmaceuticals. And I'm not saying all pharmaceuticals are bad because, you know, sometimes the devil's fun.
They're good at doing emergencies. They're good at the emergencies.
Yes. This? More in front of you? Yeah, in front. That's even better. You can pull that top elbow down or you can pull
Let's start Rebecca.
Right there.
Pharmaceutical is good for emergencies.
Yeah, they're great. They save lives.
But people go there for everything.
You can't go there for your mental health.
Yeah.
You can't go there for your health. You go there for your crisis. And we do need a lot of help with that. And sometimes you have to go there to manage your symptoms too. Like you got something going on, you need help and management. You help manage that system because sometimes the body's kind of gone so far gone that it needs help.
Yeah.
So there's times and places, but I just think it's overutilized and whatnot. So what we were going to talk about though is then how do we change the perception? Because what we were talking about before we got in was Dr. Mercier. We had a conversation with Dr. Mercier, and one of her patients came in to see us the other week, or just this last week. And she comes from like an hour plus away, Oak Lawn somewhere. And her big thing was her desire was to conceive. And she hasn't had any kids yet. And she's not super young, all right? But she was a patient of Dr. Mercier. Has been working with her for a while now. Not any success yet, you know? And then she saw Jen and our podcast. And she says, I'm going to go see Dr. Foss. So she comes in last week and she just got her first adjustment yesterday. But she's on a care plan in the office to reprogram the nervous system, get the stress, the distortion and everything out of the nervous system to lay down new neurological patterns to help with neuroplasticity so that her hormones can get back into balance. She gets out of protective mode, so her body and mostly her brain feels safe, so that she can conceive. Because if the brain and nervous system is always in this panic, stress, fight or flight response, neurological fight or flight consistently, the brain's not going to feel safe enough to be able to conceive. And that made sense to her. So she got under care, coming for a care plan for multiple times per week for
From
3
0 to
months
1.
for an hour each time. And I told Judy, our assistant, I said, she's going to be here for the next 3 months. I said, an hour away. I said, do you know what kind of person or patient doesn't do that and make that kind of commitment? Back pain Bob.
Well, also the
Because-
person that lacks the knowledge of it entirely.
Yeah. So your perceived value of what you're receiving is going to determine, and then also your desire for that outcome. Back pain is tough. I don't want to poo-poo it. I think that I've had it, and I know that it's horrible. It sucks, and it sucks the life out of you. You can go anywhere down the street to somebody to help you with your back pain. It's a dime a dozen.
Yeah.
All right. And thank God for chiropractors that help with back pain, because they're helping people stay off of pseudo heroin. What's that called? The Sackler family. Oh, for crying out loud!
Painkillers?
Yeah, the painkillers
Yeah.
that essentially are heroin.
Yeah. Super
It's
addictive.
The opioids.
Yeah.
At least we're keeping them off opioids, and I can't remember the specific name. Well, guess they had a whole mini series about it.
B. Starts with a B, right?
I can't. Who cares now?
Yeah.
Google it.
Yeah. We need a
Sackler family.
Come
I
on,
know
Jamie.
I know
Pull it up,
all
Jamie.
of the details around it, but the actual drug name it escapes me. Oxycontin.
Yo,
There
yeah.
it is.
Yeah.
At least they're not taking Oxycontin. You can go to a chiropractor to help you with your back pain, so you don't get hooked on heroin. Oxycontin.
But
All
then
right?
people become conditioned to that is what chiropractic
Yes.
is.
So when you say chiropractic, 99% of the time, we're always going to back pain, neck pain, just something back. And chiropractic is not back. It's brain. It is brain. It is neurology. Chiropractic was founded on tone, neurological tone. So it's energy, vibration, and frequency of the nervous system, for which chiropractic was founded on in 1895.
Yeah.
And then somewhere along down the line, we got pushed into this corner of back and neck pain. Actually, if the medical system had it their way, we wouldn't even exist.
Yeah. You touched on something great, and I don't mean to cut you off.
No,
but you touched on
we
something
can move
great
on.
a couple days ago. We were talking. I asked, I was getting adjusted, and I said, can you believe that there are people that go their entire life without getting a chiropractic adjustment? Because this is my form of health. I don't go to the doctor. Sorry.
Yeah.
I don't get drugs, right? Like
Right.
I get adjusted.
Right.
And you said, well, it's the one thing they can't control. They can control the diet. They can control people, people diets and detoxes, but they can't control the inside out approach.
Yeah.
And it's interesting. So how can we flip the narrative on that as quick as possible? Back and neck pain, right?
Yeah.
But if you think about it from the lens of it's the nervous system, the back and neck pain is kind of just like a cheap answer for it.
Yeah. It cheapens it, and it's on purpose.
Yeah.
It's absolutely
It makes-
on
yeah.
purpose.
Yeah.
So the same people, so maybe we'd unpack this. Why do people have a distorted perception of chiropractic? So therefore they have a distorted perceived value of chiropractic. Because if we really knew what it was and what it's designed to do, wow. You know how the food pyramid got flipped upside
Yeah.
down?
Yeah.
Thanks, RFK Jr. I mean, that's going to help. It's not going to really, it's still the doing on our part and responsibility on our part, but at least people have a little bit more better direction to take. That's still not going to move the needle.
No, it won't.
When the healthcare system gets flipped upside down, that's when the needle gets moved. That's when the needle gets moved, because our health starts in utero. All right? And if we think about our kids and where we start our healthcare journey, if I were to ask you, where does that healthcare journey start?
Starts when I am in my mom's stomach.
Yes,
Conception.
100%. 100%.
These are polarizing ideas, but it is what it is.
So where do we go for
Everything's
conception?
polarizing nowadays.
An OB, right?
Yeah.
There's an OB learned about. So when we flipped that pyramid around and we start going to professional nurse midwives who understand how a woman's body is designed to give birth versus how, oh gosh, there are literally, watch, here's a movie for you to watch, The Business of Being Born. And you'll start to understand the pharmaceutical, medical, industrial complex that has flipped and made the U.S., which Dr. Mercier and I talked about, one of the most dangerous places to have babies. And that's also where they plant the seed for what you need for health. And then, so we already get the programming started down the wrong pathway. Then once we have this baby in a hospital, because that's the norm, how it's been programmed into our minds for decades. It's not normal to have a baby in the hospital. I'm going to refer. It is not normal to have a baby in the hospital. It is normal to have your baby in home. And sometimes a baby needs to be born in a hospital. I'm not saying that it doesn't. I'm not saying it's not. Oh, but I had this problem and I was high risk and blah, blah, blah. Most of the time, medicine makes you high risk without actually truly being high risk. But again, too many rabbit holes to go down. So it starts with OB. Now the baby's born. What's the next what's the next place we need to go for our health?
Well, they put the baby into the IU, right?
Well, if they need the NICU, but in order to get out of the hospital, on your papers, you have to have a pediatrician listed to get out of the hospital. Pediatrician. Let me tell you this. Now, there are some really good pediatricians out there. I love some of these pediatricians because they've kind of shifted their practices from being your typical medical establishment pediatrician to, you know what, they're going to be vaccine, we'll call them vaccine friendly. All right? And they're going to have other supplements and other natural type systems. Holistic, right?
Yeah.
So those are pediatricians that are outside of the norm. 90% of pediatricians are unnecessary. The biggest cause of your child's health problems, and they need to be absolutely 100% eliminated from our healthcare system. That's right. Eliminated. You want to have the sickest kids on the planet are the vaccinated, pediatric, grown kids. We've got the results. Every single day, I see the results in my office for children that are raised in the traditional American healthcare model of pediatrics. They get your kids sick with poison from the start. You can't jab yourself healthier. You can't drug yourself healthier. And the reason our kids are so disconnected, dysregulated, immune imbalanced, neurologically poisoned, autoimmune, allergy-ridden, autoimmune-ridden, autism-ridden, neurologically just absolutely shut down, healthcare messed up kids is because they start their life in a pediatric office that poisons them, that doesn't understand where health comes from. You check the nervous system first and foremost. And when the baby gets ripped through a birth canal, and a mom that's stressed out to her because she doesn't understand how powerful her body is to actually do this on her own, and that she needs epidural and Pitocin. And if that doesn't work, we got these C-sections that are really great and they're safe and they're effective. And when you realize that all of that stuff creates more harm, damage, and nerve system distress, when you realize that all of those things happen, and then the baby comes out all chemically stressed, physically stressed from being ripped out of the birth canal, and then you take them to a pediatrician who doesn't check their nervous systems, and they say, we're having a hard time latching. He's arching, and they just seem uncomfortable a lot, and they're really hard to console, and they've got all of these things going on, and the pediatrician says, well, maybe they've got an ear infection, or maybe they've got colic. Maybe they got colic, or maybe they got this, so they're not
super common.
If they have latching issues and colic, baby, you got to check that nervous system first and foremost. They have lip tie, maybe. So that's starting to get there. The reason their mouths and lips, yes, I'm not going to disregard lip tie, but you check the nervous system. You check that sympathetic nervous system to make sure that it's not overloaded. and you calm the nervous system down, and their mouths begin to work and they can begin to latch, and their colic goes away because their vagus nerve is now activated, and now their gut is in their digestive tract isn't so stressed out, and it can actually process food, and it can actually connect to mom. But if a mom is dysregulated and stressed because of a stressful pregnancy, a stressful delivery, she had this horrific hospital, most of the time, I shouldn't say horrific hospital experience, but most of the time the hospital experience with births are not necessarily peaceful.
Well, I have a great story for that for you. I'll pull it up later, but my
So can I
tie it back.
on? Because I went off on a really big
No,
rant
I
and
need you to
tangent
tie
on
it up.
that. Which brings us back to why people don't understand chiropractic. Because we've been trained and conditioned that this is where we start, this is where we go next, and if there's a problem, you go back to those same people, and it's just a program that we're running. And we are running on programs that have been instilled inside of us from places that we don't even know. From our media, from our school, from our medical doctors, it is all programming. And we'll unpack that in a second, where that leads back to with history. Hold that one. So because of our programming, we have no understanding of what chiropractic truly is and what it's used for and where the value is. So our perceived value and perceived necessity for this incredible, powerful practice of health is distorted. So if we can get moms to understand that you're powerful, you can do this, your body's designed for this, have a team around you to support yourself and to educate you as to how your body can do this. And if you need extra help, we have that too for medicine. Thank God for medicine for the extra help when we need it. But it's not the lead horse. Chiropractic's the lead horse. All right, you don't put the cart before the horse. Medicine's the cart. That's what follows behind if we need it. The lead horse is chiropractic because chiropractic is your body's spirit. It's your body's innate intelligence that knows how to heal, how to create life, all of these things. That's the most powerful healing force, creative force in the universe. So if we can change our perspective and understanding that chiropractic is about tapping into that force, restoring natural health and healing that we're designed to have so that we can express health to our full potential, we don't need to worry about viruses and bacteria, which is another lie that our medical system, school systems, and all these other systems tell us that we need. Oh, it's viruses and bacteria that cause us to be sick. No, it's not. It's a weak interior. It's a weak resistance. That weak resistance comes from neurological stress. How does the neurological stress get there? Physical traumas, birth process, slips, falls, poor posture, biomechanical stress here on the spine that distorts the information superhighway, the nervous system. So physical stressors, chemical stressors and toxins from all sorts of injectable things to oral, whatever, medications, all sorts of
Nose
food,
spray, all this
stuff, our food, our poisons, all the things. And we're starting to now wake up to the toxic level, right? And that's where most people kind of go to first, right? So we got physical stressors, we have chemical stressors, and lastly, the emotional stressors. This fear-ridden mentality that we are kind of born into ignites subluxation and neurological distortion. So those are the things that cause subluxation. And I don't know where I was going, sorry, but man, when we can get that back and get the signaling back happening, get the tone regulated back with the nervous system, we start connecting to that deep, powerful force that's within us. And we don't need, like I said, all the other things. We don't need all. What would happen if we stopped vaccinating? I can tell you one dang thing. You might get a couple of extra measles or mumps, but nobody, I shouldn't say nobody. Death from measles, mumps, rubella, polio, chickenpox, all those things are so rare. You don't die from these things. And I can tell you for a fact, you won't die from these things when your resistance is higher. Those that die from these mild, benign childhood infections, they're infections, not diseases. It's a rash for 7 days and you're done. Or would you rather have autoimmune and autism for life?
Yeah, for life.
Because it poisons your brain and disrupts your immune system. Do you see how we've been just completely mind manipulated to fear certain things? Oh, and what else are we
To
supposed to
become
fear?
weak, Doc.
We should fear the chiropractor because they're not real doctors and they'll probably hurt you. Oh my God. Oh, so yeah, words are powerful. They rule the ship. So if we can start using our words differently and start understanding that chiropractic, kairos, that it's not back, it's kairos.
From God.
Yeah. We're restoring the power that God's put in you to heal and regenerate. Now, is that a lot better than
Sounds a lot
back pain doctor that maybe you go there once to pop your back in? No, we're restoring life.
Well, I'll tell you what, aside from the overall perspective of chiropractic, some chiropractors get a bad rap, and we've seen that locally.
Yeah.
Now, we don't have to go too in depth if we want to. We can if we want to, but it's
There's good and bad at
sad.
everything,
Yeah, there's good and bad at everything, but chiropractic definitely seems like one of the niches of, I guess, health in general, where if something bad happens, everyone's running with that, and you can't do anything about it.
Do you know any other situations where that is? Where if you have one bad experience at something, so restaurants do not have that experience, right? You go to a bad restaurant, even if it's a specific restaurant, a Mexican restaurant, you go to a Mexican restaurant.
Even if it's a chain restaurant.
Yeah, right?
Yeah.
You don't go say, well, I'm never going to have Mexican food again. Or I'm never going to have that chain restaurant food again. Or you just throw the entire restaurant industry under the bus and say, I'm never going to a restaurant again because I had a bad meal over here and I had diarrhea. That doesn't happen. But you know where it does?
Health. People's health.
No, because dentist, you go pick another dentist.
Yeah.
A doctor, you pick another medical doctor. It happens in racism and bigotry.
I'm interested now.
If you know how racists are, so if you got a dark-skinned individual, it's the whole race that's like that.
Yeah.
So it's ignorance.
Oh.
Ignorance is what causes that. Because would you say racism is pretty dang ignorant?
Yeah.
Yeah. Because it's lack of understanding.
Yeah.
You're not even understanding where this other person's coming from.
Yeah.
Ignorance, my friend. You know how hard it is to deal with ignorance, especially when that ignorance has been intentionally placed into your mind? Who did that? Who did that?
Well, now you're going on a great side route here. If you on that same note is if you look at history, Doc, kids were not getting these mass amount of drugs up until this 200 or 150 year period that we've had in the past 150 years.
Yeah.
Right? Look to the thousands and thousands of years prior.
How
were people
survive?
being healthy? Sunlight,
Yeah.
right? Not to be biblical, but we've talked about this. You read the book of Luke, you hear Luke was a doctor. What did a doctor look like in the first century?
Stethoscope and a bottle of pills?
Yeah, no. So
what do you think a doctor looked like in the first century?
The laying of hands.
The laying of hands and prayer.
Yeah.
And maybe some plant-based medicines that come from their garden or something.
Well, think about it, right? If we're not giving kids supplements, no, come on.
Oils, maybe
That's
some
retarded.
frankincense.
If we're not giving kids all these extra stuff, then what is health in the first place, Doc?
You mean if we don't poison our kids, they might not get sick?
If you remove all the stuff that we say is health,
Yeah.
and you focus on what actually is health, what is actually health in that sense? It's focusing on the inside out.
Yeah.
Everything else is outside in.
Outside in on everything. Even you would mention it. Even supplements and diet, which is good. We want to have a clean diet. Supplements are good in their time and place too. Detoxes, all those things are appropriate when they're needed. But that's still outside in, just like drugs, just like pharmaceuticals. But pharmaceuticals are also needed at times and places too, right?
Yeah, for sure.
That's all outside in. What do I need from out here to make my inside better? And what's been distracted and ignored purposefully is the inside out. It's inside out. We have to restore what's inside of us and express it out. So that way, if we're restoring the inside, it can take what we put from the outside in better.
Yeah.
It's the foundation. It's the, what is it in chemistry? It is the catalyst to making anything else in your life work better. Chiropractic, the catalyst for life.
Yeah. Oh, it's so crazy. Oh, people still aren't going to be able to understand it, but it's true. I'm a personal reflection of it.
Yeah.
I've said this, I said this earlier on this exact same podcast. I don't do anything else. I eat healthy, right?
Right.
You know, that's basic stuff.
Yeah.
I don't do any of the other nonsense. I only get adjusted.
Yeah.
I don't get sick, doc.
Yeah.
COVID-19, it hits my house. Nobody in my house gets sick.
Yeah.
Oh, I wonder why that is. You guys just must be a really healthy family. Well, it's because we have healthy nervous systems, healthy immune systems.
What would create a healthy nervous system?
Not all the outside stuff in.
Right.
Yeah.
And then supporting that inside out, which is good diet. So diet, people are like, what kind of diet do I need to go on? And here, how about this? The non-poison diet. Just start, because it's not about what you necessarily, the supplements that you have to add, doing all of, what it really is really is addition by subtraction. It's if you can stop just putting in the garbage. I'm not going to tell you how many proteins to eat, how many carbs to eat, avoid this and this. Sure, yes, you're going to avoid seed oils and sugar and refined this, but that's all the stuff that's synthetic and whatever. If you just kind of, everybody knows what to eat. There's just a lot of great marketing out there. You can buy this prepackaged product over here, and we're going to put keto, and we're going to put sugar-free, and we're going to put all this stuff where we've kind of hooked your brain into thinking that that's what health is. Let's just try to eliminate the bad stuff and just eat some natural food, you know?
Yeah.
And then, so that's one thing that distorts from your body's ability to heal. Toxins, stress, turn off your TV because that's nothing but a mind-washing, mind-numbing, fear-engaging, and propagandizing. 100% propaganda. Not 100%. Their propaganda is 100%, but what's on the television isn't 100% propaganda. It's a lot. We won't call it all. But if we can reduce the television, the screen time, because there's propaganda in that too, how do we believe all these things that we believe? How do our brains get programmed into thinking these things that we need for health and life and longevity are actually stealing from our life, health, happiness, and longevity? Well, we have to turn off the influences that are brainwashing us. And we have to disconnect to reconnect. So that's the chemicals, that's the emotional and energetic vibrational. So instead of propaganda, we start praying. Prayer over propaganda. That's another, I'm coming up with bumper stickers, bro. Maybe we reconnect to our source, to God. Maybe we open up the Bible. I saw this great video, and it said, what if our Bible was our phone? And somebody's sitting at a stoplight, and they pick up the Bible, and they start reading like this. And they're walking with their kid down the street, and their head's down, reading the Bible kind of like this, like you see everybody doing with their phone. And I thought, wow, that was a powerful message right there. As I was looking at my phone, reading it, watching it.
I've actually seen that exact same thing too, but it's a great. No, we don't have to go down that avenue, but it's
I had to finish
principle,
with the third. Yeah. So we had the chemical stressors. If we just remove that, and the emotional stressors and energetic stressors, remove that, and the physical stressors. Man, we just actually need more physical stress. We need more activity instead of sitting in a classroom all day, sitting in a chair with Billy. And I don't know why he's not paying attention, because he freaking needs to move his body so his brain works. He's not ADD. He's not hyperactive. Well, yeah, he might be hyperactive because he's sitting like a caged freaking animal in a classroom. That isn't
in a microwave.
Yeah.
Yeah.
So, yeah, we just need to disconnect to reconnect. How did we get here? Can we get what were you going to ask? Sorry.
Well, you mentioned the Bible real quick, and it's like my phone. I sit on my phone for a couple hours a day, and what benefit does it bring me? It brings me no benefit at all.
Yeah.
I can't, at the end of the day, when I look back at my phone or when I look back at the TV show I watched, it was all just entertainment for the time being. And there's no reflection of it. And maybe this is just me. Maybe some people have photographic memories and they can see every single reel they watched. But that's not me, and that's not the majority of society either. So there's no benefit to be sitting on social media all day, to be sitting on your TV all day, to be watching the news all day.
dopamine
It's all
hits.
it's dopamine hits, but then
dopamine hits.
there's a sensation of adding fear to people's lives. If you can add fear to people's lives, you control them. And
100%.
that's all we see on our phones. It's all we see in television and in our TV shows and movies. It's programming people just to
So all the ICE things that
become
are
fear.
going on now.
Yeah. Why even care about any of that stuff, Doc?
Yeah. Well, some of it is you can't be ignorant.
Yeah, of course. And listen,
Right.
loss of life is terrible.
Yeah.
I never want anybody ever to be murdered
Yeah.
in broad daylight. But
Yeah.
250 years ago, when there was no mass media,
Yeah.
the same thing was happening.
Yeah.
And people still lived their lives.
Yeah. Now it's utilized as a way to control the masses and their minds more because a human being that's stuck in fight or flight has no access to their frontal cortex. No access. And that's where all of our ideas, our imagination, our solutions come from. You can't tap into solutions. You can't tap into the future. You can't see a bright future when you are stuck in fight or flight. And that's our entire culture. Where did that start? I got a pretty good idea. Might have even started before then, but when things really started churning, the early 1900s, started even before that, late 1800s. But as far as for healthcare and we'll say media go, the fire had already been started, so to speak, the late 1800s. But once Rockefeller took over in the early 1900s, that's when we started gaining steam, right? If you have control over healthcare and health education and the medical schools, public schools from K through 12.
The voting system.
Yeah.
It just gets bad, Doc.
The
We
media,
could go down all of it. Yeah.
the media, the newspapers, the television, Rockefeller Plaza. Where's that at? I don't know. NBC. I heard it on the Saturday Night Live. Here on Rockefeller Plaza, Saturday Night Live. And it's like, oh, yeah, Rockefeller. And they own the energy and oil. So they own oil, public school, college, medical school, media. They've got their fingers caught in the banking system.
They can control the
That
narrative.
is powerful. They control the narrative. There's a thing called the Flexner Report, which was done in 1920, and that's when Rockefeller hired this Dr. Flexner to go out there and say, hey, what's going on in the medical schools out there? Dr. Flexner came back and says, gosh, I tell you, they're teaching homeopathy. They're teaching natural type health cares and stuff, these doctors, but we need to systematize it because they're all kind of teaching different things, but none of it's all together and systematized. So Rockefeller says, we're going to systematize this, and what we're going to do is we're going to bring in petroleum-based pharmaceuticals. Oh, and by the way, I own the petroleum plants. So Rockefeller owned the pharmaceutical companies to begin with and the medical schools and tried their damnedest to eliminate homeopathy, midwifery, chiropractic. When you try to, there's no such thing as competition in Rockefeller. Rockefeller even says, I hate competition.
Yeah.
I hate competition. So what we have to do is we have to monopolize the situation. So we're going to own the pharmaceutical companies. We're going to own the schools. We're going to own the media that is able to project our essence of what we want to do to this culture. So from the time you're born, from the indoctrination education that you get, to the things that you watch on television or read in the newspapers back in those days, everything was scripted and controlled by this. And so then it's generational. It's generational. So it gets, just like a kid knows how to run a cell phone now, we get our programming gets generational in our DNA. And we wonder why now when we say chiropractic, we have this disillusion, this maybe even like gut-like feeling that we don't even understand. I had the same one in college when I knocked on the chiropractor's door, knew nothing about it. I just knew that I liked anatomy.
Yeah.
I was thinking about physical therapy. I was thinking about sports medicine. And I go to this school where there's like 1,500 people in town. That's the size of the town, Fayette. We call it Vietnam.
Yeah.
You went in, bro. What you went in, you got to have your helmet on and get some napalm because it takes a lot of gut and courage to get through a private now. So anyway, so we go to knock on his door. He's like, I said, I'm thinking about chiropractic, Well, I don't know anything about it. In my head, they're just back doctors. They're not real doctors. So number 3, it should be easy to become one, and I could be a doctor. I'm thinking easy way out because I'm stupid. I'm 18. I just want to drink beer and chase girls and be dumb. Sorry. I learned a lot since then. All right. So I just put myself. So then I discover what chiropractic is. As it clears up my allergies, my sinus problems, I start getting straight A's. I start dialing in. My elbow problems go away. I'm like, why didn't somebody tell me about this when I was, 18 years ago, when I was having issues as a kid and sinus problems and headaches and strep throat and flu and all the things
that are common to kids nowadays.
And I said, we're going to change that. And that's what I said 26 years ago. And 30 years ago when I decided. And so here we are. So yeah, that's how the programming starts. So it's not anything new. I just started unpacking it all and started seeing where the source came from. But we're busy. We got kids, we got baseball, we got basketball, we got shopping, we got mortgages to pay, we've got so much on our plate. Who's going to dive into the history of healthcare, our education system, taxes, money system?
No, you're crazy.
And now I'm crazy because I'm the one that dug deep and spent the time to unpack the corruption and the propaganda. Full circle. Propaganda.
Well, you do hear people talk about this stuff, right? But there's a fear of being ostracized.
Yeah. Well,
when you're head deep in the profession,
the most ostracized profession on the planet,
that debunks all of it. You're already like, okay, I don't care.
I don't care because I know truth. I've seen truth, and over the past 5 years, I love the Bible and I love Jesus. I should say I thought the Bible was cool and I thought Jesus was cool. I love Jesus now, and I are starting to understand that the Bible has more truth in it than a elementary school science textbook.
Oh boy, we're unpacking a lot because is there any truth in the elementary school scientific textbook?
Well, I don't know.
Outside of the periodic elements?
I haven't read a whole lot of it lately, but that's kind of hyperbole.
I know.
With a slice of truth in there is that I'm starting to understand there's so much truth inside of it that, you can start to differentiate truth from propaganda and lies. And here's another thing. It is really easy to fool somebody. And it's really hard to tell somebody and convince somebody they've been fooled.
That might have actually been Rockefeller who said that.
It could have been. I don't know. But it's really hard. It's really hard because, I'm the crazy one. And I've been the crazy one beating his crazy drum on the side of the corner telling people to stop poisoning their kids. That if you really want to have healthy kids, stop taking them to the places that you're taking them for your health, for their wellness visits, for their jabs and their stuff. Stop it, because you're just making them sick. You'd be better off giving your kids cigarettes, for crying out loud. Honestly.
Bro, that's not a crazy statement. No, I don't know. Obviously, that's again a joke, right?
It kind of, because when you start looking into nicotine and nicotine receptors in the brain and how nicotine can actually help heal your body. Now, you don't put in nicotine with 100 other chemicals like the big tobacco industry did, which then they took over the food industry and started doing the same thing in your food, and that's why your food is poison, and that's why cigarettes are poison, and that's why your drugs are poison. For crying out loud, just stop poisoning yourself and poisoning. And it's coming from everywhere. So you got to be aware. You got to understand that there's marketing, there's propaganda to keep people stupid, ignorant, and sick. Because you know who's easy to control? Somebody that's stupid, ignorant, and sick, and fear-based. They're easy to control. You know who's hard to control? Somebody that wakes up and gets it. But just call them crazy. So that way the people that are,
you can't control anybody else.
Well, yeah, because the regular people are going to say, oh, they're crazy. People are waking up, bro. They're seeing it left and right, and I'm seeing it in my office. And I'm not like, I don't have to even, in my office, I don't hold back. Oh, I do hold back a little bit. There's a little bit of a filter. But once we've connected and you start to understanding the truth about chiropractic, when people start, every single time, I'm telling you, Jack, every time somebody comes into my office, they said, I had no idea.
Because it's the catalyst, Doc.
Yeah.
If there's no prior knowledge, like a personal reflection moment for me, there was no prior knowledge of any of this stuff. And then COVID comes along and my mom's like, you're not getting the jab. And I'm like, well, obviously I wasn't going to get the jab. I was healthy anyways because I go to a chiropractor. Okay, well, but a lot of people don't go to a chiropractor.
Yeah. Your mom was on the fence also with just kind of vaccines in general, not really knowing.
Yeah.
But after COVID, she's like, oh.
Yeah.
Yeah.
And it's then the rabbit hole just.
Then if this was a lie and I lifted up underneath the hood and found out what was
the scales
really
were pulled
on,
off my eyes.
And then you start doing that with everything because then that inspires you to say, well, what about this? What about this area that I'm not supposed to look at where the science is settled and everybody knows? So just go along with everything. Just follow the herd, Jack. Follow the herd. You don't want to be different. The laws are, you don't want to be made fun of. You don't want to be called stupid.
Oh, what? You don't believe what they told you?
Oh, what are you, a conspiracy theorist? You a conspiracy theorist, Jack?
Oh my gosh, we're gonna get crazy here. But you're
Conspiracy
absolutely
theorist,
right.
76, normies 0. I think that's about the score these days.
Yeah.
Not all the conspiracy theories are
I
true,
don't
but
think
they
we
all
ever
have
lost.
a slice of.
We've never lost.
I'm telling you, Jack. And if it does seem like we lose, just wait 6 months and
wait 6 years
or 6 years, and then they'll
or wait 16 years.
Yeah.
It just comes around eventually.
Comes
But
around
you're
eventually.
hitting on a great point when it comes to the conspiracy theorists and chiropractic because it's like the gateway drug to it all.
Yeah.
And
well, you're considered conspiracy theorist if you don't go along with everything that the norm says is what you have to go along with. If you buck the system in any way, conspiracy theorist. Ooh, you know who made up the term conspiracy theorist?
the government.
CIA. For people who didn't want to go along with JFK's assassination.
Yeah.
So they came up with the term conspiracy theorist. Oh, those are the people that aren't going to follow us.
Those are the people that are going to be ostracized for their opinions, for critical thinking.
Yes, so we got to call them something weird so that way people don't take them seriously. Then it just continues. It's a fun life, Jack, to uncover some of this stuff.
Yeah, it seems like it's definitely a coordinated effort to speed up people's lives. So then they choose the quickest thing or the easiest thing, which is here, give your kid 5 drugs.
It's
here,
called
give your kid this. We're gonna give our kid benzos. He takes that, then he gets more drugs because he's dealing with another thing because of that, and then you're stuck. You're stuck. The moment you pull the kid off, he's already screwed.
Yeah,
and
it's called social engineering and social conditioning. Social engineering means that this is it social engineering or cultural engineering? It's called social engineering. It's engineered to produce this result that we see. None of this is by accident. It's also not organic. It is planned. That's a conspiracy theory. Bullshit. No, there's evidence everywhere that it's planned. Event 201. Do you ever hear of Event 201?
No.
That's the plan that preceded the COVID scandemic. John Hopkins University, Bill and Melinda Gates Foundation, CDC, WHO, all of these groups came together on a think tank called Event 201 that says, well, if there was a worldwide
epidemic,
what would we do?
Oh
well, we would ostracize the dissenters. We would have a vaccine that got us out of it. There's going to be dissenters that try to disprove that the thing even exists. There's going to be dissenters that say that there's other things that you can do for this sickness, and there's going to be dissenters that say that the thing that we create is going to be bad. So they covered their bases on all of it. They knew exactly what was going to happen. The event happened. It was all event 201. Just look it up, bro. And you start to see this thing, this cultural, social, and societal engineering that happens. We're just a big engineering experiment for the think tanks that are trying to run us.
We're just a bunch of donkeys, and they're hanging the thing in front of us, and we're just walking along.
But once you wake up to it, it's like, oh, have you ever seen a cat chase a laser?
Oh yeah.
I saw the greatest meme one time, and it was two cats chasing a laser, and they're like, and the guy's up here going like this, doing the laser like this, going back and forth. The cats are going, and the gray cat stops, looks up at the person doing this, while the black and white cat's still moronic and like controlled by the whole thing, and he's staring right at the person that's doing this with the laser. And that gray cat are the people that wake up and say, I know who's controlling this now. I know who the people are and the systems are that are in place that are trying to force me to do certain things and take this pathway. And the people that are trying to tell me to wake up that say, don't do that pathway, even though everybody's doing it. And everybody seems to, and our autism rates are 1 in 36, and our allergy rates are this, and our ADD rates are this, because we're following the same freaking pathway. The problem isn't the pathway. And these people over here telling you that it's because of this pathway, no, they're conspiracy theorists. They're not real doctors. They're just kind of pseudo people over here, pseudo scientists. And you start seeing how inverted the world is, and where the pseudoscience is, and where the witchcraft and propaganda is over here. Our world is inverted. And who is the great inverter and the great deceiver? Yeah, pharmakia. It all blends together, doesn't it?
Yeah.
It all starts to make sense.
Yeah.
Wow.
Now you got me thinking. Well, oh my gosh, I can cut this, but I'm just thinking now. Like it's so deep. You can't.
It is deep. It's really deep. But let's try to raise it up.
Like, what was even the beginning of pharmakia?
Again, Rockefeller. Well, it started even before then. So if you think vaccine, anti-vaxxers, who came up with anti-vaxxers? Same people who came up with conspiracy theorists. It's the same kind of terminology so that they use that so that we can have polar opposites. You're a pro-vaxxer, you're an anti-vaxxer, you're big, you're blah, 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 blah. It creates the polarity so that they can create division and then continue on, right? So who created, so vaccines actually started in the late 1800s with the smallpox thing. So the scam started then because
people were easily controlled then.
Getting vaxxed, and they were dying left and right. Yeah. But they didn't want to give up on their vaccine savior thing that they had full faith in. So they manipulated numbers. They did this, that. So smallpox is another huge scam. Look into smallpox, because if we believe that smallpox vaccine eradicated smallpox, we are delusional that it even happened like that. But we believe it because our school books say that that's what happened. We get this very superficial bullet point version of what went on without understanding any of the history underneath it. But once you start, again, looking underneath the hood and actually seeing the documentation from those years, it paints a completely different story. So when did it start? It's kind of started then, but again, it's Flexner Report, it's Rockefeller. This latest 100 years has been in full. It is now a steam engine, but that steam engine has been coming up against some pretty strong resistance,
pretty strong current, wind current.
Yeah, resistance these days. So but it's been going on again. So this epigenetic thing, it's also called in MK Ultra. They call it the monarch effect.
Yeah,
where it's not just phenotypes that get passed down. It's kind of like memory and ideas get passed down, not physiology. So again, I have heart disease and that's genetic. No, it's not genetic.
You're just a retard.
Sorry. Yeah. So there might be some genetic predisposition, but genes are your blue eyes, blonde hair. Yes, genetic. Your physiology.
No.
This much.
Yeah.
And the rest of it is on you. Now, ideas and some beliefs and past histories and past traumas, it's called the monarch effect, where they started, the MK Ultra people said, they call it the monarch effect because trauma-based mind control can get passed down, and then children will be in the same system because they're easier. They've already got the trauma-based mind control epigenetic programming in them. So that's the monarch effect. They got this because monarch butterflies, they'd be like, how do they make it down from America to South America and back? Because their lifespan isn't long enough for them to make a full trip. And they started realizing the memory and the consciousness gets passed down. So that's why, again, kids know how to do cell phones when they come out of the womb. Well, if we've had 100 years of programming of what medicine is and what you need for your life and your health to be healthy, and we got all these other programming and propaganda that's been going on for 100 years and steam-loaded hard and heavy over the last 20, we've got a lot of deprogramming to do. That's why it's such a hard task for me to say chiropractic's not about back pain. It's about your brain. It's about restoring, and it's not your brain either, because a dead person has a brain. It's about the spirit and the energy that flows through it. It's the tone. It's energetic. It's life that flows through your nervous system, uses your brain. So we use the spine to affect the tone of the nervous system, which then affects the brain and then the rest of your body. It is massive. It's huge. But you can see, what if we spent an hour here unpacking things and going down every kind of, there's so many different angles, but it all comes together to say, all right, we're back to the rudder of the ship, our words, our languages, our ideas. Why do we believe what we believe? When we say a word, why does it emit its this idea in our head? Why does it affect our gut a certain way where we're not even processing the name of the word? It just gives us a feeling. Well, it's been programmed into us. It's on purpose. How do we deprogram? I don't know, go to the Bible, go to your chiropractor, start going to your natural health care provider because natural health care providers understand this history. They do. Homeopaths understand this. We get it. But we've been ostracized and pushed off in the corner where it's like, oh, this is the stuff you do if you just want to look pretty, and it's the lipstick on the pig. It's not the structure, it's not the meat and potatoes, it's not what you really need to be healthy. Leave that to us, the medical professionals. Yeah, flip that shit around, bro. Because your medical professionals are the little bit of sprinkle and sugar that you need over here.
During an emergency.
But for your life, trust the Kairos. All right.
We can keep going, obviously, but that was the perfect end right there. Dude, unbelievable. I didn't even know any of this, the Kairos, chiropractic, any of it at all. I'm surprised you haven't told me any of that.
There's a phrase out there.
Like chiropractic, the breakdown of that word is restoring what is from God. The action. The practice. Right, because actic is the action of restoring what is from God.
Word. That's it. I've never even come up with that one. The action of restoring what is from God.
Yeah.
Jack.
So then what did a doctor look like back then? Well,
laying of the hands.
Yeah. He looked like a chiropractor.
Oils.
Oh, come on. Right?
Oils,
frankincense. That's what health was.
Yeah.
Yeah. Oils, frankincense.
Prayer. Yeah.
Sure, it was part of it, right? Yeah. Sure, the oils and stuff.
Laying of the hands with a prayer. Do you know that's essentially kind of what I'm doing when I'm doing chiropractic?
Yeah,
I'm
laying
my hands.
Yeah.
And I'm helping kind of direct the innate. And you know what? I think I'm going to add some more prayer in there too.
Yeah.
Just direct to God.
Yeah. Well, energy. The body contains energy.
Yeah.
That's also a neglected idea.
So that's again, through our cultural conditioning, energy's woo-woo.
Yeah.
It's woo-woo.
Yeah. Energy is just woo.
You mean you just got some spirits and some crystals.
What is getting my phone LTE right now?
Yeah, energy. We live our life with this energy in this energetic world. Everything we do, we send messages, we launch missiles, we open our garage door, we set our temperature. We do everything through this computer McPhone that we have.
Yeah. And it just is LTE. It just is, it just is 5G.
Signals, sending out signals, receiving signals, sending signals, receiving signals. Do you know what your brain does?
Does the exact same thing.
It sends signals. No, if we have a tower that's not so tall and it's all crooked and kinked and whatever, can we send and receive signals so well?
No.
So this is your tower. This is the motherboard. Your spine is the motherboard, circuit board human, the human circuit board, which is regulating and processing, doing essentially the signals that we are sending out. Our body is an energetic electromagnetic sender and receiver of signals. It is the most powerful thing that we have to have regulated. It is the ground level. It is the foundation. It is the structure. It is the power. But what we've been told is that energy is woo-woo. And it's something that you can kind of do on the side that helps this powerful foundation of medicine, pharmacy, whatever. And it's like, no, man, like you said, flip it.
Yeah.
Flip it. We need it, yes, but it's not the foundation.
Yeah, we need it, yes, but why is a Walgreens on every corner in every town, right?
Yeah. Yeah.
It's true. I was actually thinking about that, and I'm not trying to go down a whole different tangent, but I was driving in St. Charles. I'm like, okay, there's a Walgreens, and then there's a Walgreens over there, and Walgreens everywhere. And because that's
Applebee's.
Yeah.
By the Taco Bell.
Yeah.
The McDonald's.
Over by the full drive-through of McDonald's.
Yeah. Yeah. It's just how we're
What's the most powerful thing on this earth, Doc? The human body.
Yeah.
And we just neglect it.
The spirit.
Yeah, the spirit of the human body.
Yeah.
The human body can be dead, right?
Yeah.
The spirit that resides in us.
Yeah. We're more powerful. That's, I think, Jack, I think we're hitting on something. That's the part where they don't want us to know, because they know how powerful we all are. And especially if we get together and start understanding these truths as a momentum, as a culture. Can you imagine the culture that would exist if we eliminated all of this inverted satanic bullshit from our lives and started living with truth from within?
In community,
and seeing how powerful we truly are. We'll figure it all out. We don't have to have all the answers, but I tell you, when a community comes together with a problem, with a situation, with whatever, we figure it out. Well, how would we have schools if we didn't have taxes and stuff and government? And how would we have roads and libraries? And I'm like, crying out loud. Here's how we figure out to live life without these this thievery called taxation. That's another avenue. One, do you value it? Yes or no? No, then we don't need to be taxed because we don't value it. Yes? All right. If we value it, maybe we should be taxed. Would you, great, if you value it, would you pay for it on your own?
No.
If you wouldn't, then
we don't need it.
Then go back to question one. Do you value it? Yes, you value it?
I don't.
All right. Then if you don't value it, then you would never pay for it. You would never pay for it anyway. So if you don't value it, you don't value it. So you don't want it.
Yeah.
You don't want it.
Yeah. If you wouldn't pay for it on your own, you don't value it.
And if you don't value it, you don't want it. So do you want this thing? Do you want roads? Yes.
Yeah.
Would you pay for roads? Would you pay for roads? Yes.
I guess I'd have to say yes.
Yes, because you're paying.
Yeah.
So if you would pay for roads, then
you
you would pay somebody privately to figure out as a community to get together and make some freaking roads. Do you value education? Yes or no?
Yes.
Yes. Would you pay for it?
Yeah.
Yes.
So you pay somebody directly for it.
You
right?
pay somebody directly for it.
Yeah.
Yeah. And if you didn't like that person,
why am I paying as a collective
why
for
am
all
I
this nonsense?
Because you're not paying for schools anyway. You're paying for indoctrination, and you're paying for taxes and war and all this other stuff that you don't ever want anyway. We don't want half the stuff that our government is spending taxes on. It's waste, it's fraud, it's neglect, it's all the stuff. People, leaning centers, right, in Minneapolis.
Yeah. Quality leaning center, leering center.
Leering centers, there it is. So no, if you value it, you'd pay for it. And if you paid for it, our communities would figure it out. So again, if we start coming together with these realizations, oh my gosh, how much power we would have. But the people that are in the control, that are controlling the government, the banks, the media, the industries that have given us all of these socially conditioned, that have been engineering our society
and divided one family against each other,
dividing and conquering to keep us separate, because separate we're less powerful, isolated, fear-based. It's to control, man.
Yeah. Well, I'll tell a little story, and I'm sure you feel the exact same way when you were a kid. When you were a kid, all the neighbors, we just go over to each other's house. Nowadays, I don't even know my neighbors.
Yeah.
And
And you wouldn't have to text that you were coming over.
Yeah, you just walk in the front
over,
door.
knock on the door.
Yeah, or you just walk in the front door.
Yeah, that too. We unpacked a lot here, Jack.
Yeah,
We unpacked a lot.
yeah,
But I think if we can maybe pull it all together in the end, it's unlearning, because it's much easier to unlearning what we've learned. But that's hard because it's easy to
be
fool
fooled.
somebody than it is to admit that you've been fooled. So to unlearn, we'd have to admit that maybe we got it wrong. And then compare it to something that is a little more on track and see if that resonates. Even though at that front, it seems like, well, that can't be right. Unpack it and try to understand it to see, because our understanding of what it is might not be true. So it takes a little time. And then that takes some self-reflection too. So gosh, some self-reflection. So if we can just unlearn and we can start to get together as a community and start to unpack and understand where health is, where it comes from, why our system is the way it is, we can really come together and just create amazing lives for each other.
Amen.